I work with children with feeding and swallowing difficulties, and they range in age from approximately 6 months to 19 years. Most of my referrals come from paediatricians, from dietitians, from health visitors or other health professionals. I work with children across a range of difficulties. Children may have cerebral palsy, they may have complex medical needs, and I can also work with children who have behavioural feeding difficulties. When I see children, I assess their ability to eat and drink. I assess their oral motor skills to establish if they can chew adequately and swallow. Sometimes children may need their textures modifying because they do not have the full range of oral movements to deal with certain textures. Often children have a swallowing dysfunction, so they are not able to actually physically swallow what they are eating or drinking. And in my assessment, I then make decisions about what is safe for them to eat and drink. I work with dietitians on the nutrition. I work with physiotherapists on positioning, which is obviously very important for eating. And I also work quite closely with the paediatricians, and they do base their decisions on our assessment findings, particularly around making decisions about alternative feeding, for example, gastrostomies. And we, as speech and language therapists, are pivotal in making this decision. About 99% of children with cerebral palsy do have some degree of eating or drinking problem. So they do form the majority of my caseload, and these children are very compromised physically. So we have to look at the child as a whole in terms of their eating, in terms of their positioning, in terms of also their communication. Some of these children do have very poor swallows, and the consequence of this is they can either choke on food that they are not able to manage, or food and drink can go into their lungs, which has serious medical implications. They may develop pneumonia, for example, and this is quite serious for these children because they are very compromised medically anyway. So when we're talking about the safety of swallow, on one end of the spectrum, it may be mild coughing. On the other end of the spectrum, it may be seriously compromising a child's health and, in fact, life. Our role is very important in making the decisions about swallow safety and where on this continuum that child does lie. Clearly, feeding is a very emotive issue, and we need to take into consideration parents' feelings, apprehensions and worries and anxieties about feeding their children, because another major consequence of a feeding difficulty for a child is the stress within the family that causes, and we need to be very mindful of that.
Afifa's got child development problem. Basically, she's slow in her development. When she was about 2 months old, she started having all these things, and the doctors doesn't know why. They're still investigating it. She had swallowing problem as well. She was vomiting a lot. Whatever she had, she just vomited out. And then the speech and language therapist, they helped me out, checking her swallowing and everything. And then they suggest the doctors to do barium swallow for her to find out what is the main thing in her swallowing. Because of that, they find out that due to her brain, she's slow in her brain, so that's why her muscles, her throat muscles, everything are quite soft and slow as well. I think this NG tube has helped me a lot. In the beginning, speech and language therapist told me it will be best if I have this NG tube for her, because she was vomiting a lot and she aspirated a lot. And after having this fitted in, I think it helped me a lot because her medication goes right to the place. She stopped fitting quite regularly. Her vomiting has calmed down. she used to be always irritable, crying because of stomach pain. That all has calmed down a lot. And so now I'm willing to go ahead with the gastrostomy. Solid goes through her mouth. She can take that, just 1-2 spoons. And liquid stuff, she had it all through her tube, because she aspirate a lot with liquid stuff. In the beginning, when she was 2 months old, and when the doctor told me she needed speech and language therapist to help me out, I was quite puzzled. Speech and language therapist, isn't she too small for talking and speech? But then when they got involved, when they helped me out, then I realized what their job is and how they help me out. It was really helpful having them every step. They do home visit. Sometimes it's once a month, sometimes it's 2-3 months afterwards, and just check on her swallowing and see what kind of food I give her. And they show me the signs. When she chokes, it's when shall I stop, and when she is ready to have another feed, like another spoon. They show me all the signs of what Afifa needs and how she should be swallowing it and everything, and which I think is very helpful. At the moment it was the swallowing, but now they're trying to talk about her speech and her language, how she's going to start talking, and how they're going to be involved in it now. Personally, from my experience, I think speech and language therapists did help me out a lot in everything, because I didn't understand what this NG tube mean, how am I going to be using it and everything. They did taught me a lot and what is the benefit of it and everything, so I think it's really good.